Good morning, everyone, and welcome to the return of the annual forum hosted by the Canadian Institute for Military and Veteran Health Research. Today marks a first for CIMVHR in moving our annual event to a virtual format. I am pleased to join all of you once again as the MC for today's kickoff event. Je suis Michael Brennan, directeur administratif de la Fédération nationale de la police et membre du conseil d'administration de l'Institut. To begin, please allow me to acknowledge the Indigenous peoples of all the lands that we are on today. While we are meeting virtually, we acknowledge the importance of the land to Indigenous peoples who have been its stewards long before the arrival of European settlers, lands which we all call home. We do this to reaffirm our commitment and responsibility to improving relationships between nations through our understanding of local Indigenous peoples and their cultures. I now have the great pleasure of introducing Dr. David Pedler, Scientific Director of CIMVHR, et Madame Cécile Malardier-Jogrou, Vice-rectrice de la recherche au Collège militaire royal du Canada, ainsi que membre du conseil d'administration de l'Institut. David and Cécile.
Hello, everyone, and welcome. It's wonderful to see both new and familiar names joining us today. And while I know many of us would prefer to be together in person, I'm pleased that technology allows us to gather virtually and that we could achieve the same goals of sharing the knowledge and world-class research generated by our community through this online forum. To begin, I would like to acknowledge the difficulties and challenges presented to all of us during the pandemic. It has been a year like no other, more than a year. I should say, in a period of time that has required continuous flexibility and reevaluation. At CIMVHR, we are thankful to those who have been on the front lines of the COVID-19 pandemic. Our first responders, public safety personnel, healthcare professionals, and active members of the military. Their courage and resilience and their dedication to keeping our communities as safe and healthy as possible has been very inspiring. And we are, of course, continually awed by the Canadian Armed Forces as they demonstrate again and again their ability to adapt quickly to unique and challenging circumstances and to deliver tremendous support and expertise where it is needed most. The frontline work is and has been vital. However, we all know that the research and work of generating new knowledge about the communities we serve is critically important as well. Without a doubt, researchers, many of you here today, have also shown resilience and flexibility. Researchers have navigated numerous challenges and added pressures during the pandemic and forged on to conduct studies that will impact and improve the lives of active military members, veterans, public safety personnel, and their families. And this, of course, is why we are all here, to share and discuss the research and how it affects and enhances the well-being of the populations that we serve. Our role at CIMVHR has always been to act as a hub that helps to make connections between key research areas and specific populations by bringing experts, knowledge users, and funders together. And we are grateful that, despite a pause last year, we are back in this virtual way to come together and share crucial insights and new knowledge. Over the 10 years that this forum has been held, there have been over 1,450 research presentations. Now, this is an incredible number, and it speaks to the breadth of the work being conducted in the field of military, veteran, and family health research. And we know the impact is indisputable. The population we serve are complex and evolving, working and living across the world, people who face unique risks, exposures, and experiences that deserve and demand new standards of protection, prevention, and care. Our goal is to transform lives, to ensure that with each passing year, we address people's shifting needs and change their lives for the better. The impact of the work being conducted within the field of military, veteran, family, and public safety personnel health research is far-reaching and evolving as new and environmental drivers change the landscapes in which people work and live. And this is particularly of importance now with increasing challenges at home and around the world. It is needed more than ever. So I will now invite my colleague and CIMVHR board member, Cécile Jagreau, to say a few words. Cécile, please.
Thanks, David, and a warm welcome. Merci, David, et bonjour à tous et à toutes. C'est un plaisir de présenter le Collège militaire royal du Canada, une des institutions fondatrices de l'Institut canadien de recherche sur la santé des militaires et des vétérans. David, vous avez mentionné le caractère complexe et évolutif de la vie du personnel militaire. Il est très intéressant de voir à quel point la recherche émergente prend en compte les expériences et les besoins différents des femmes et des hommes, et comment la dynamique des soins familiaux a changé. Étant donné que la recherche détermine souvent les politiques, l'analyse fondée sur le sexe et le genre est une considération importante pour s'assurer que les décideurs comprennent les besoins de l'ensemble de notre personnel militaire. Les recherches sur la prévention des blessures morales sont également fascinantes, de même que la façon dont, dans nos institutions, nous pouvons transformer les organisations et les équipes pour offrir un environnement sûr au sein duquel les gens peuvent exercer leurs dons. La gestion de la détresse morale sur le lieu de travail est particulièrement importante pour les militaires en service et le personnel de la sécurité publique, car les facteurs de stress moral ne peuvent être entièrement supprimés du travail. Ces risques ont augmenté avec la complexité du travail dans le cadre d'une pandémie mondiale. Mais nous avons beaucoup appris. Ces découvertes et bien d'autres vous seront présentées ici au forum au cours du prochain mois. Nous vous y attendons en grand nombre. Ce forum est une opportunité exceptionnelle de présenter toutes ces avancées. This forum is an exceptional opportunity to present and learn about all these studies. Bon forum.
Merci, Cécile. Now, Dr. Pedler will announce the 2021 CIMVHR Fellow recipient.
Thanks, Michael. The CIMVHR Fellowship Program was launched in 2016 to recognize leaders who demonstrate exceptional research advancement within the field of military, veteran, and family health. CIMVHR Fellows are outstanding researchers and committed mentors. Their work and commitment are invaluable to the advancement of innovative, world-class research for our military, veterans, and their families. Today, I have the honor of announcing a new CIMVHR Fellow who has not only shown endless commitment, but has also brought forth research results to educate and inform others on their outcomes. It is with great pleasure to announce Lieutenant Colonel Andrew Beckett as the 2021 CIMVHR Fellow. Lieutenant Colonel Beckett is the trauma advisor to the Surgeon General and Chief of General Surgery in the Canadian Armed Forces, an assistant professor at both University of Toronto and McGill University, and the medical director of the trauma program at St. Michael's Hospital. Lieutenant Colonel Beckett, welcome as a fellow, and thank you for your service and your continued support of CIMVHR. Thank you.
Thanks very much, David, and thanks very much all of CIMVHR for giving me this great honor. It's, CIMVHR has been part of my life for at least 11 years now, and it's always been great to be involved. And I actually I've learned so much through CIMVHR and received so many opportunities to advance my research and my learning. And I've met so many great colleagues at CIMVHR who have helped me along the way. And I almost feel that, I can, not quite, ready to accept this honor because I think I owe so much to CIMVHR for helping me in my work that I've done. And again, it's a great honor to be elected as a CIMVHR Fellow, and I look forward to continuing to produce high-quality research in collaboration with CIMVHR and Canadian Forces Health Services, and as well as Defence Research Development Canada to provide the best results for our soldiers and veterans.
Congratulations, Lieutenant Colonel Beckett. It's now my privilege to introduce Major General Bilado, Surgeon General of the Canadian Forces Health Services Group. Major General Bilado has served as a family physician in the Canadian Armed Forces since 2000. He has occupied several staff leadership and command positions within the CAF, either in Canada or abroad. Depuis 2013, il est visiteur pour Agrément Canada. Il est également détenteur d'une maîtrise en administration publique. Il a présidé le comité directeur du Centre de médecine de famille du Collège des médecins de famille du Canada, en plus de coprésider le comité technique sur les soins de santé primaires de l'Organisation des normes de santé. Throughout his leadership career in healthcare, he has been awarded multiple titles and honors, including the title of Fellow from the College of Family Physicians of Canada and Honorary Fellow of the Royal College of Physicians and Surgeons of Canada. He holds the titles of Certified Health Executive and Canadian Certified Physician Executive. Major Général Bilado.
Invités distingués, mes chers collègues, mesdames et messieurs, j'aimerais tout d'abord vous remercier pour votre participation au forum de cette année, malgré que celui-ci soit virtuel en conséquence de la pandémie qui nous affecte tous. Votre présence aujourd'hui témoigne de votre engagement en faveur de la santé de nos militaires, de nos anciens combattants et de nos familles. Since its creation in 2010, the Canadian Institute for Military and Veteran Health Research has acted as a remarkable research, knowledge, and education hub, delivering multitudes of products and solutions that have been instrumental in furthering our understanding of the health issues for the Canadian Armed Forces and Veterans Affairs Canada. On behalf of the entire Canadian Forces Health Services family, I would like to congratulate and thank the CIMVHR team for their outstanding performance during this last decade. Thank you also for organizing this prestigious annual scientific event. I have no doubt it will be a tremendous success once again this year, despite the unique circumstances. This conference is an ideal venue for our healthcare providers to maintain and expand the clinical knowledge necessary to provide the best evidence-based standard of care to CAF members. Nous apprécions vraiment votre dévouement et nous vous remercions de nous consulter régulièrement afin de vous assurer que les ateliers et les sujets présentés lors de votre conférence soient pertinents pour la santé des militaires et des anciens combattants. I would like to take a moment to acknowledge and thank everyone here today for your interest, engagement, and hard work to advance our knowledge and understanding of military and veterans' health in all its domains. And by actively participating, our military members and veterans ensure that researchers are well informed of our unique requirements and that they recognize the differences between civilian and military populations, which helps to assure the relevance of their research efforts. I am pleased to announce today that so far, as a direct result of our unique and unprecedented relationship with CIMVHR, the Department of National Defence, together with Veterans Affairs Canada, have awarded 95 health research projects at an approximate value of $19.5 million to this fantastic network of researchers. De nombreux rapports et produits issus de ces initiatives ont contribué à améliorer notre compréhension des problèmes de santé des militaires et des anciens combattants et à répondre aux priorités du gouvernement dans ce domaine. La plupart de ces projets concernent l'étude à long terme des problèmes de santé mentale et physique rencontrés par les populations militaires et les anciens combattants, tandis que d'autres répondent aux besoins importants des familles de ces deux groupes. Il est également important de noter que cette recherche produit souvent de nouvelles connaissances ayant un impact considérable, bien au-delà des populations de militaires et d'anciens combattants, et offrant des avantages pour la santé de tous les Canadiens. All of us together, we have made tremendous progress since CIMVHR was created, but we can't rest on our past achievements. We know that the consequences of the Afghanistan mission, compounded by the recent events, and of other military assignments to include the CAF response to the COVID-19 pandemic, will continue affecting the health and well-being of military members and veterans. With a solid decade of experience and now 45 Canadian universities and 14 global affiliates partnering to supplement CAF and VAC research, CIMVHR has truly matured and gained international recognition for military health research. Et comme nous l'avons fait au cours de la dernière décennie, grâce à votre appui et à vos efforts soutenus, nous pouvons ensemble continuer à développer un programme durable de recherche sur la santé des militaires de calibre mondial, conçu pour appuyer vos forces armées canadiennes et reconnu par tous les Canadiens. It is now my pleasure to introduce the 2019 winner of our Sir Frederick Banting Award for Excellence in Military Health Research and our next keynote speaker, Dr. Ruth Lennious. Dr. Lennious is a professor of psychiatry and a director of post-traumatic stress disorder research unit at the University of Western Ontario. She established the Traumatic Stress Service and the Traumatic Stress Service Workplace Program, services that specialize in the treatment and research of PTSD and related comorbid disorders. She currently holds the Harris Woodman Chair in Mind-Body Medicine at the Scottish School of Medicine and Dentistry at the University of Western Ontario. Ses intérêts de recherche portent sur l'étude de la neurobiologie, du trouble de stress post-traumatique et sur ses diverses méthodes de traitement pharmacologique et psychothérapeutique. Elle est l'auteure de plus de 150 articles et chapitres publiés dans le domaine du stress post-traumatique et est actuellement financée par plusieurs organismes fédéraux. Elle donne régulièrement des conférences sur le trouble de stress post-traumatique à l'échelle nationale et internationale. Dr. Lennious has recently published a book entitled Healing the Traumatized Self, Consciousness, Neuroscience, and Treatment, with Dr. Paul Frewen, an associate professor in the Department of Psychiatry and Psychology and graduate program in neuroscience at Western. She was the 2019 recipient of the major Sir Frederick Banting Award for her research entitled Alpha Neurofeedback as an Adjunct Treatment for Post-Traumatic Stress Disorder, a Randomized Control Trial. Cette étude, qui visait à enseigner aux participants l'autorégulation des fonctions cérébrales par le biais d'une interaction avec un jeu informatique, a fourni des preuves que le traitement neurofeedback peut réduire considérablement les symptômes du SSPT et même restaurer certains des principaux réseaux cérébraux affectés par un traumatisme. Please join me in welcoming Dr. Lennious to the virtual podium.
Good morning, everyone. It's an honor and a privilege to be here today. And I'd really like to thank the Surgeon General for inviting me to give this talk. And what we'll focus on today is really moral injury and how deep moral wounds can run. And we're going to talk about first-person experience of moral injury, what happens in the brain and body, as well as what we can do to help and how we can treat moral injury. This program has not received any financial support, and I have no conflicts of interest. But before I start with the talk, I would like to thank all my collaborators without whom this work would not be possible. And I'd like to start out by thanking the Moral Injury Group, and that includes Chantel Lloyd, Braden Terpu, Margaret McKinnon, Kim Ritchie, as well as Maria Densmore, Susie Southwell, and Stephanie Neville. And I'd also like to thank others who've really supported this moral injury project. And these individuals include Alex Hebert, Fardaus Husseini, Rakesh Jetli, Anthony Nazarov, Charlene O'Connor, Sean Rind, Don Richardson, Patrick Smith, and Jim Thompson. Thank you to all of you. And of course, also thank you to our funders. When we think about moral injury, I think Romeo Dallaire immediately comes to mind. And General Dallaire has really taught us through his first-person experience and his writings. And he says, moral injury is a deep and profound assault on what you are as a human being, an injury that ravages our minds and our souls. So how can we understand moral injury? And moral injury can really arise from violating deeply held moral norms. For example, having to shoot a child to keep the troops safe, or by witnessing a trusted other make such transgression. So, for example, witnessing the killing of civilians. But moral injury can also involve betrayal. So being directly affected by someone doing something or failing to do something. And I think this is what we've seen with military sexual trauma, for example, right? That individuals who had very violating experiences did not feel heard, and their complaints were often not taken seriously. And so this betrayal has often had a profound effect on these individuals. So moral injury is frequently associated with severe internal anguish, as Romeo Dallaire has written about, blame-related emotions, feelings of guilt, shame, anger, and rage, really negative beliefs about self, loss of meaning, loss of trust, and profound social disconnection. And often people who suffer from moral injury are really feeling disconnected from the rest of the world and are feeling very, very alone with their suffering. Moral injury has been linked to the development of post-traumatic stress in both military and law enforcement populations. It's also been associated with depression. And I think importantly, it's really been associated with suicidal thoughts and attempts. So often people experience such anguish inside that they're really much more prone to suicidality. I had a profound experience with a veteran about a decade ago, and I interviewed him, and he told me, you know, Ruth, I cannot look anyone in the eye for fear that they will see the stain on my soul for what I have done. And at the time, fear was really still the predominant paradigm for post-traumatic stress. And I thought, this is such a profound statement. We really have to think about moral injury whenever we deal with trauma. Of course, moral injury is often hidden, right? People feel guilt, people feel shame, they feel intense internal anguish, and that's very difficult to share. Often people withdraw, they become disconnected. And so I think making the invisible wounds of war visible is incredibly important. Not only to be a validating experience for the individual suffering, but I think also to reduce stigma. And I think in terms of stigma, we've come a long way, but we still have a long way to go. And when we think about comparing orthopedic injuries, for example, severe fractures, and people having casts and crutches, it's so much easier to have empathy for those individuals. So I think really helping to make that invisible wound visible through brain imaging will have an important effect on decreasing stigma further. So here we really wanted to examine what happens when people who experience post-traumatic stress recall a traumatic memory where they experienced moral injury, and what happens in the brain when they do so. And so I'm just going to summarize our findings very briefly and talk about how those findings may relate to their clinical experience. So the first area of the brain that we see much greater activation in people with post-traumatic stress who suffer from moral injury, when we compare that to individuals who don't have post-traumatic stress, but who did experience a morally injurious event, is that we see activation in this area called the dorsal anterior cingulate cortex. And don't worry about the name. What's important is that that's a brain area that activates when we process social norm violations. And so we see more activity in individuals with post-traumatic stress and moral injury as compared to people who don't suffer from post-traumatic stress. The other area that seems to be really affected in individuals with post-traumatic stress and moral injury is called the right posterior insula. And this is an area of the brain that really helps us to process those visceral sensory information. So when we have an emotion, you know, that gut-wrenching feeling that often goes along with it. And again, I think that really draws to our attention how much emotion is not just a cognitive experience, but really an embodied experience. And so this area has also been associated with moral disgust. And so how does activation of this brain region relate to the experience of a lot of our study participants? And several describe the experience of moral injury recall to be both nauseating and painful, like an internal gnawing sensation. And a couple of people said, it's eating me alive inside. And so this may really represent the activation of that posterior insula in the brain. And now just imagine feeling like this is eating me up alive inside, and the picture of this soldier here. It's no surprise that moral injury is really related to post-traumatic stress, depression, and suicidality, right? Really intense suffering. And the third brain region we saw involved in moral injury recall was that the area called the left dorsolateral prefrontal cortex was more active in individuals with post-traumatic stress who'd suffered from moral injury. And this is an important brain region. It exerts a lot of top-down control on intense emotional experience. And so this may be an attempt of the brain to really down-regulate that intense emotional experience. And here I also want to talk about that. I'm not trying to say that the brains of individuals with PTSD are dysfunctional, not at all. But rather, what I'm trying to say is that the brain is trying to adapt. And I think by giving these signals of this intense visceral distress, they're allowing the individual to know there's something wrong. You need to do something. And again, those top-down regions then help the individual to really soothe that distress. So I think it's really about how the brain adapts to trauma. It's not a dysfunctional brain, it's a highly adaptive brain. I also want to talk to you briefly about brain connectivity during memory recall of morally injurious memories. And here what we're seeing is the top network is a network that's related to our sense of self, how we see ourselves in the world and how we view our identity. And in post-traumatic stress during moral injury and also during traumatic memory recall, this identity network becomes hooked up with the deep reptilian brain that again processes these visceral emotional sensations. And so now we're getting these visceral sensations, this eating me up alive, really having a profound effect on how we view ourselves in the world. And so I think what we're really seeing is that trauma-related affect and arousal influence self-related thoughts and perspectives. So the sense of self becomes seen through a trauma lens. And I think this also leads us to really change our thinking about, I don't think it's I think, therefore I am. It's more I feel, therefore I am, and how these deep visceral feelings can really affect our sense of self and our identity. And so what we see in moral injury and distress is really that these experiences may become central to one's identity. And that is a very painful process to overcome. It's doable and there's hope, but it's a painful process. And of course, this also has big implications for military sexual trauma, where the individuals who didn't feel heard about what they experienced, who didn't feel understood, and who didn't feel that their complaints were acted upon, often their identities and their sense of self have been profoundly affected. They've lost a sense of meaning, they've lost connection with the military troops and their comrades, and they've lost trust. And so luckily we have great leadership in the Canadian military here through Denise Preston and Chantal Rell, who will lead us, I think, through a really transformative change, where I think we can begin to listen, develop mutual understanding, and really work together, through this truth and reconciliation approach to make the Canadian military the best military it can be. I think we need also to think about moral distress and injury in relationship to the COVID-19 pandemic. And of course, this is something we've lived through for the last year and a half. And here our group has been involved with Margaret McKinnon's group at McMaster and Kim Ritchie to really conduct some qualitative interviews that tap into the first-person experience of our healthcare workers who've been really affected by this pandemic. And they too experience morally distressing events and moral distress and moral injury in the aftermath of the pandemic. And some of the key factors that have been morally distressing for them involve the inability to provide the care people needed, feeling forced to provide distressing life-saving measures when there was no hope of survival, the fear of transmitting COVID to yourself and to others, and not being able to provide necessary emotional support to individuals and their families when they died, and not really having time to grieve the deaths. Often they were faced with a big disruption in family life, and they now feel guilty and ashamed about having been a bad parent or a bad partner. And often they felt very betrayed by their institutions for not having received adequate support in terms of staff or PPE. A study led by Dawn Richardson and Anthony Nazaroff have also supported these findings and have shown that higher moral distress is really associated with decreased resources at work, exactly what the healthcare workers were reporting in the qualitative interviews, decreased leadership support, increased risk perception, and a number of psychiatric symptoms. So moral injury and distress is very much happening in the aftermath of the pandemic as well. And I think the pandemic, military sexual trauma, and combat moral injury can all inform each other. So how do we overcome moral injury? Of course, that's a key question. And again, I think we need to realize that moral injury is not something that we want to talk about, right? Guilt, shame, intense anger is not something that's easy to talk about. And often people who experience, especially a lot of shame, don't want to be seen, right? Often their posture is collapsed and they have difficulties making eye contact, just like that soldier explained. So, looking at our peers, looking at the people around us, watching their postures, and when we see individuals like the two we see on the image, really reaching out and supporting each other, I think is critical. And really being aware of how difficult it is to make eye contact when you're suffering from moral injury, especially shame. And clinically, often when I ask people, do you feel ashamed? They say no. But when I ask them, what's it like to make eye contact? That often provides an opening to talking about moral injury and shame. I think we need to enhance self-compassion, right? When you feel shame, guilt, extreme anger, often individuals don't feel deserving of experiencing self-compassion. So really taking some time to enhance self-compassion, make time for self-compassion is absolutely critical. And I think this can be done alone as well as within a group. I think we need to heal within a community, right? And I think the military provides such a community, and we have to be really mindful how powerful communities can be to really enhance the healing of individuals. And I would postulate that healing moral injury really will require a community for all the different types of moral injury that we've talked about today. Peer support is also critical, and Stefan Grenier was the first one who really brought peer support to the Canadian military. And we now have peer support for both men and women in the military. And I think it's wonderful to see how peer support is also developing for military sexual trauma, a key piece to healing. But some individuals, even though they may do great through these various options, may require some treatments that are really guided by what's happening in the brain. And not everybody will need this, but I think some individuals will. And I think the individuals that will really need that are those who come into our offices and they tell us, I know it was not my fault, but I can't stop feeling it. It keeps tearing me up inside. And of course, our treatments are often directed at the talking part of our brain. So we talk about things, and often we can reverse how we think about things, but often those deep visceral feelings are left to be very painful and like they're tearing people up inside. And I think that's when we need to think about what happens in the brain and how can we target those deep brain areas that really modulate those visceral sensations directly. And so we need to target those deep brain circuits. And often that's not entirely possible with just talking therapies. So what options do we have available? And one is neurofeedback, and it's a form of biofeedback where we receive feedback, direct feedback about how our brain is firing on a computer screen. And through that feedback, we can teach people how to quieten their brain and how to quiet that visceral distress that often goes along with post-traumatic stress and moral injury. And we've shown through mechanistic studies that neurofeedback can actually get deep within the brain and change connections in the brain very deep at that visceral level. We've also done a randomized control trial of neurofeedback and post-traumatic stress. And we find that it can decrease significantly symptoms of post-traumatic stress. And when we look at a 3-month follow-up assessment, we see that 61 participants in the experimental neurofeedback group actually no longer met criteria for post-traumatic stress as compared to 33% of the control group. In terms of future directions, we really want to look at other forms of treatment as well that we can use adjunctively to help sufferers from moral injury to really calm that deep visceral distress. And here we're looking at a therapy called deep brain reorienting, where we really want to help people to reorient from that deep visceral distress to the present, where they feel safe. And so this therapy is really designed to calm these deep, painful emotions and target those deep brain areas directly to restore self-related thinking, identity, and connection. To end this talk, I want to end on a note of hope, and I want to present a quote from one of my patients who I treated for moral injury. And he said, "Before treatment, I felt subhuman. I felt like I did not deserve to live. Now I'm beginning to feel human again. I can laugh again, and I feel like I'm starting to deserve to feel joy. The love I experienced from my whole family has made such a difference to my healing." Thank you for your attention.
Thank you, Dr. Lennious. That was a truly engaging and fascinating presentation. We've received some questions from our participants. So if you don't mind, I'll ask you the first one. Dr. Lennious, this was an absolutely great presentation showing enlightening insights on how to identify moral injury clinically. Is there an approved scale to diagnose moral injury, and a follow-up, if there is none, how is it treated, based on which criteria? How to identify what is to be cured? How to measure the success of the treatment? So there's a lot of questions wrapped up in that one request, but over to you.
Yeah, thank you so much for that question. And, you know, all these sub-questions, of course, are really relevant. So how can we measure moral injury? And there is a scale, for example, developed by Brett Litz and his group, his international group, that is available to measure moral injury. There's several other scales under development as well. So I think the field is really making great progress in measuring moral injury, and also in different populations are scales being developed. And I'm happy to share some of those measures if there's an interest. And of course, how do we treat moral injury? And I think that brings us to the whole question of really needing to think about, you know, the classic PTSD we've been taught for many years, really centering on that hypervigilance, and how moral injury differs from that, and how, you know, the visceral aspect of both PTSD, focusing on hypervigilance, but also on moral injury, may be different, and how the brain areas that are activated and the networks are different in the two types of PTSD, and also, of course, how the clinical first-person perspective is different in these two types of post-traumatic stress, if we can even say there are different types of post-traumatic stress. And there's still some controversy around that, of course. But I think when we think about treatment, it's always important to take a personalized approach and really see what each individual is suffering from. For example, is this one individual suffering more from the hypervigilance type of PTSD, or from suffering from moral injury that's tearing him or her apart inside? Or are they having aspects of both forms of suffering? And so how can we personalize that treatment? And so, of course, whenever we think about treatment, I think the first thing we need to think about is prevention. And I think when we think about prevention, the Road to Mental Readiness program developed by the Canadian military, I think can be very helpful for individuals to track, you know, how am I doing? You know, am I starting to get ill with symptoms of hypervigilance? Am I starting to get ill with symptoms of moral injury? And then to, as much as we can, of course, prevent those symptoms. But if we haven't been able to prevent those symptoms, how can we treat those symptoms? And I think, again, both for prevention and treatment, peer support here will play a critical role. And the Canadian military has always been at the forefront of really developing excellent peer support programs. And I think it allows an individual to, you know, really express their difficulties and not feel so alone with those difficulties and receive that support. And we know how important support is in the aftermath of trauma and how it can prevent really a great amount of suffering. So I think peer support will be critical. And I think we need to heal within a community, right? And I think the military sexual trauma we've seen in the recent months and years, I think is moving towards healing in a community, right? And using a truth and reconciliation approach, right? Both parties need to be heard in a safe place. And I think that's the beginning of reconciliation. And when we think about our healthcare workers, our public safety personnel, and how the institutional lack of feeling of safety has played a role in moral distress and moral injury, I think we really need to think about, how can we make institutions safer? And then I think there'll be individuals that, despite those interventions, and we see this clinically, will keep having those visceral difficulties and those thoughts, it's my fault, I did something horrible, and it will continue to eat them up. They will continue to feel like they're eaten up inside. And I think for that group of individuals, I would recommend that we really need to think more about taking a brain-based approach to treatment of moral injury. So to really track, what is happening in the brain? How does that relate to first-person experience? And how can we really target those deep brain levels that are so associated with those visceral experiences? And our veterans often tell us about those and how it's so hard to talk people out of moral injury, right? Because those visceral sensations remain. And I think we're making some progress in the development of adjunct treatments that can target directly those deep visceral brain areas and networks. For example, Neurofeedback has been able to do this. And also, I think there's some progress being made with a new method called deep brain reorienting that targets directly those deep brain pathways. And, as we do more interventions, then I think we have to track very carefully, how do symptoms of moral injury resolve or not? And also, what component of moral injury resolves? Do the cognitive elements resolve only? For example, it's my fault, I did something horrible, I'm a horrible person. And to what extent do those visceral sensations also resolve? And I think we really need to track both, because in order for an individual to feel healthy, to be able to really change their identity and, feel okay with what they did, we'll need to change things at both levels. So I think there's many things to be done, but I think there's a lot of hope and we're learning more every day.
We do have time for one more question. It's quite specific to your research. The question is, did you screen for symptoms of traumatic brain injury in addition to PTSD in the clinical research?
Absolutely. That's something we always screen for because, of course, it's so common in military members. And for this research, because, head injuries can be a real confounding factor, we screened out people with significant head injuries and loss of consciousness.
Okay, very good. To wrap up, it's a fascinating field of research, obviously very important given what we're seeing now in terms of the Canadian Armed Forces wanting to do better for its own members. One of the questions that we asked earlier had to do with measuring progress. Before we go, can you touch a little bit on both in terms of clinical interventions, but also institutional evolution? What would you be looking for in terms of tangible progress in this field?
I think for individuals that we move toward institutions where individuals feel increasingly safe, because I think, the environment and the individual experience, but also the biology, it's really interacting all the time, right? One informs the other. And so I think the environment we live in has a huge effect on who we are, who we can connect with, as well as our biology. So I think seeing all these factors together will be critical in moving forward. And really making people feel as safe, as heard, and as appreciated as possible, I think will be critical.
Thank you, Dr. Lennious. And again, congratulations on your research and this recognition.
Thank you.
Our next speaker is the Deputy Minister of Veterans Affairs Canada, Mr. Paul Ledwell. Mr. Ledwell was appointed Deputy Minister of Veterans Affairs in May 2021. He brings extensive experience in government affairs, public policy and research, and organizational strategy, including work with partners in government, private sector, voluntary, and the media. Sous-ministre Ledwell mettra à profit ses antécédents en matière de leadership, sa compréhension de l'administration publique et de sa pratique afin de contribuer au bien-être des vétérans et de leurs familles, ainsi qu'aux affaires nationales et aux fonctions internes de l'ACC. Please welcome Deputy Minister Paul Ledwell.
Michael, thank you. And thank you, Dr. Lennious, for that terrific presentation. Good morning, everyone. It's a pleasure to be with you here today for this 2021 CIMVHR Virtual Forum. And although we're meeting virtually, I want to start by saying that from coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations, people who call this land home. I'm joining you from Charlottetown on the traditional and unceded territory of the Abiguit Mi'kmaq First Nation. As you know, tomorrow is the first ever National Day for Truth and Reconciliation, a day to recognize and commemorate the tragic history and ongoing impacts of residential schools. It's an opportunity to reflect and participate in community events, all with the goal of being good allies in reconciliation. I joined Veterans Affairs 4 months ago, and since I have arrived, it's been an honor to be part of a team that embraces the privilege of supporting our veterans. Many of us have veterans in our lives. My own grandfather served in the Canadian military and fought in the First World War. I recognize how important the programs and services we provide to veterans are for them and their families. Leur bien-être est au cœur de ce que nous faisons. Mais il m'apparaît également clair que nous ne serions pas en mesure d'atteindre nos objectifs sans les partenariats importants que nous avons avec des organismes qui soutiennent les vétérans et leurs familles. Cela comprend notre travail avec l'Institut canadien de recherche sur la santé des militaires et des vétérans, de nombreux enjeux importants. We very much have a shared mission to enhance the lives of Canadian military personnel, veterans, and their families by harnessing the national capacity for research. From studying the impacts of COVID-19 on veterans to conducting research on inclusion, including the unique needs of women veterans, to looking at the impact of sexual trauma during military service, the work the Institute does betters us as an organization in the services we provide and seek to provide to the veteran community. Since its beginnings, the Institute has been bringing together world-class researchers and practitioners to improve how we collectively support those who serve and have served. And that's quite a noble mission. I want to thank the Institute's board members and staff whose leadership makes a contribution to our service women and men, veterans, and their families. Thank you. I extend a thank you to the strong leadership and collaboration demonstrated daily by Dr. David Pedler and Dr. Stephanie Belanger and their colleagues. And I thank all researchers and collaborators who are contributing through thought and action. Collectively, we have a responsibility to care for those who have suffered injuries and illnesses while serving Canada, and to support survivors and their families. Our mandate is to make sure that veterans, families, and concerned groups are properly supported, and this has continued through the pandemic. It is apparent from the number of attendees here today at how well we have all adapted to living virtually and ensuring our important work continues without interruption. From a very modest beginning a decade ago, the Institute and this annual forum has grown into an invaluable network of world-class researchers and practitioners working to improve the way we support those who serve and have served. At Veterans Affairs Canada, we focus on the individual needs of the veteran. We are veteran-centric, which means we place veterans at the center of every service, every contact, and every decision. One of our top priorities is to close the gap between the Canadian Armed Forces and Veterans Affairs, to enable a simpler, easier, and successful transition from uniformed service to civilian life. And I'm pleased to say that that gap is closing. Nous avons travaillé pour lutter contre l'itinérance des vétérans et améliorer leur santé mentale. We need to continue to address the stigma of mental health and to encourage those in need to seek treatment. Et grâce au Fonds pour le bien-être des vétérans et de leurs familles, nous avons octroyé de financement à des organismes pour mener des recherches et mettre en œuvre des initiatives qui soutiennent les vétérans et leurs familles. As we've gone about our business, it's been wonderful to know that the research conducted by CIMVHR is allowing us to make evidence-based decisions and improve our programs and services. Thanks to the support of the Institute, we've been able to better define and address the gender and inclusion dimension in transition, which helped lead to the creation of VAC's new Office of Women and LGBTQ2 Veterans. This unit within Veterans Affairs ensures our programs and services consistently meet the needs of all veterans, regardless of sex or gender. We have more to do, and we will do more in this area. Most importantly, CIMVHR has helped dispel the myth that all veterans are ill or injured. Research in recent years shows that the majority do well after they leave the military. There are more than 600,000 veterans in Canada, and 4 out of 5 of them transition out of the forces relatively well. For those faced with difficulties, we now better understand that their issues reach beyond health. They extend to employment, financial well-being, and social integration, areas reflected in VAC's 7 domains of wellness. Above all else, we need to continue to serve Canada's veteran population based on the evidence that comes from your work. In this regard, we appreciate the work that you've already accomplished over the past 10 years. Thank you all again for the important work that you continue to do and for continuing to make the health and well-being of Canadian military personnel, veterans, and their families a priority. Merci, Walalio.
Thank you, Deputy Minister Ledwell. The remaining portion of today's session will focus on 3 emerging researchers and the organizations that support them. CIMVHR's scholarships and awards started back in 2013 when Wounded Warriors Canada launched their prestigious student scholarship. The Royal Canadian Legion launched their scholarship later the same year. Chacun se voit décerner chaque année au Forum de l'Institut. En 2019, nous avons eu l'honneur d'ajouter le prix Dr. Mark Zumarski pour soutenir les chercheurs et chercheuses de 3e cycle en épidémiologie de la santé mentale. Please welcome Mr. Philip Edwards to present the Dr. Mark Zumarski Award. In addition to his career in public service, both as an officer in the RCAF and subsequently as a public servant in DND, Phil has also made a deeply personal commitment to the work of CIMVHR. Phil, over to you.
Merci, Michael. Ça me fait un grand plaisir d'être parmi vous ce matin pour la remise des prix. Good morning, everybody. It's a great privilege for me to be with you this morning for this award ceremony. In 2019, I approached CIMVHR to explore ways to continue the legacy of my husband, Dr. Mark Zumarski. As a specialist in epidemiological research on the mental health of military personnel, Mark led the research and analysis section of the Directorate of Mental Health for the Canadian Forces Health Services Group from 2002 until his passing in 2018. From its creation, Mark was an advocate and an active supporter of CIMVHR. He was recognized by his peers in 2013 when he received the Banting Award. In addition to his own research, Mark was passionately committed to mentoring the next generation of researchers. I can attest that in the final months while ill, he was still working hard to help his graduate researchers complete their work, as he did not want to leave them in the lurch. As a result of that initial conversation in 2019, the Dr. Mark Zumarski Award was created. The first 2 recipients, Jordana Sommer and Valérie Granger, were the recipients of a $5,000 award where they each explored different areas of the intersection between PTSD and other physical conditions. Earlier this year, I engaged in a conversation with Dave, Stephanie, and Michelle about this year's award. Given the current environment within the DND CAF, particularly that relating to sexual misconduct, and also the DND CAF Positive Space Initiative, we had a very long and engaging discussion around diversity and inclusion. particularly for the LGBTQ2+ community, both as possible focuses for areas of research, but also to ensure the widest pool of applicants for the award. As a result of that discussion, this year's application process, CIMVHR included encouragement for emerging scholars to use the sex and gender equity in research principles, as well as to use an intersectional lens in their methodologies. Je crois que Marc serait très heureux, professionnellement et personnellement, avec cet développement. Et aussi pendant cette conversation, j'ai informé Dave et Stephanie que j'ai pu augmenter le montant du prix de 5 000 à 10 000 $ pour cette année. For this year's award, I'm very happy to announce that the recipient of the Dr. Mark Zumarski Award is Sophia Roth, a psychology resident at the London Health Sciences Centre and a PhD candidate in clinical psychology in the Department of Psychology, Neuroscience, and Behavior at McMaster University. Their proposal, which is expected to include some groundbreaking research, is titled Measuring and Characterizing Minority Stress and Moral Injury in Sexual and Gender Minority Military Veterans. The research will seek to explore the unique experience of Two-Spirit LGBTQ+ military members, veterans, and LGBT purge survivors from an intersectional and mental health lens. It will examine experiences of stress, trauma, betrayal, and moral injury by exploring in depth both their stories during and after service. The unique aspect of this research proposed is that it will be the first study to explore the identity-related moral injury. The proposal aims to uncover the ways minority stress and moral injury impact the mental health and well-being of Two-Spirit LGBTQ+ members, including their unique challenges and struggles, as well as the aspects of strength, pride, and resilience unique to this population. As a CAF member veteran myself, I'm very excited by this proposal and its potential to better understand the particular challenges that affect this community, my community. Alors, félicitations à toi, Sophia. Congratulations.
Thank you, Phil, for your generous support, and congratulations, Sophia. Next, please welcome Mr. Phil Ralph, Program Director of Wounded Warriors Canada, to announce the Wounded Warriors Doctoral Scholarship in Military and Veteran Health Research.
Today, it is my honor to introduce our 9th Wounded Warriors Canada Doctoral Scholar. It seems like just yesterday that we announced our 10-year, $400,000 commitment to funding this scholarship in partnership with CIMVHR. We continue to be amazed at the significant impact that our scholars are making, including their contributions to program development. Our commitment to research continues to be a symbol of the way ahead for our organization. Today, we are positioned as a leading mental health service provider for veterans, first responders, and their families. Research has been and will continue to be central to our development. Our services offer culturally appropriate, group-based interventions that are clinically facilitated and grounded in evidence that draws upon leading trauma research. This work has been made possible thanks to the faith that Canadians have placed in our mission. In particular, we are indebted to Lumbeck for their sponsorship of our doctoral scholarship. This year's scholar, Sarah Watling, attends the Faculty of Medicine at the University of Toronto. Sarah continues the outstanding tradition of excellence that has been the hallmark of our doctoral scholars. Sarah's research topic is about measuring the amount of specific proteins inside the brain of Canadian Armed Forces members, veterans living with PTSD, and will inform the next line of effective drug discovery in this at-risk population. Sarah's research has the potential to provide critical guidance for even more effective treatments for those impacted by operational stress injuries, including PTSD. Sarah, on behalf of all of us, welcome to the Wounded Warriors Canada family. We look forward to following your progress and are grateful for your contribution to Canada's veterans.
Hi, everyone. I'm so delighted to be here this morning. I was thrilled to hear that my project was selected for funding this year. I am conducting my research out of the Centre for Addiction and Mental Health down in Toronto. I'm supervised by Dr. Isabelle Boileau, and I'm strongly supported by Dr. Sean Rind out of DRDC Toronto, Canada. And as mentioned, my research is taking a multidisciplinary approach to understanding central and peripheral markers that may be implicated in post-traumatic stress disorder in current serving CAF members, veterans, and our first responders. We're specifically using different types of brain imaging, namely PET imaging, MRI imaging, as well as some pretty novel peripheral blood stimulated techniques to kind of better gauge which proteins and processes are implicated in this psychiatric disorder. And as mentioned, I think it will be really important as we strive towards specific drug discovery in this disorder. So again, thank you so much, and thank you for your support. I'm really excited to see where this line of research goes.
Congratulations, Sarah. We look forward to following your research and examining the results later on. I'll now invite Mr. Bruce Julian, Dominion President of the Royal Canadian Legion, who will announce the winner of the Royal Canadian Legion Master's Scholarship in Veteran Health Research.
Hello, bonjour. I'm Bruce Julian, Dominion President of the Royal Canadian Legion. It's a real pleasure to be with you today, even at a distance. I've been looking forward to announcing the newest recipient of the Legion's $30,000 scholarship in veteran health research. I'd like to congratulate Meredith Seeger from the University of Manitoba's Department of Community Health Services. Meredith is a research assistant in the Rady Faculty of Health Sciences. She will investigate the chronic pain profile among still serving military members and veterans of the Canadian Armed Forces who develop effects of traumatic brain injury, or TBI. She will look at parameters like prevalence, demographic trends, and variables that may moderate or mediate the effects when it comes to TBIs and the development of chronic pain. She will compare still serving members and veterans and will look at differences in males versus females. Meredith's study will also look into post-injury well-being, inclusive of mental health, moral injury, coping, and social support. Her evaluation will provide us with a much better understanding of the mental and physical health issues surrounding traumatic brain injury. Ultimately, her findings could help with the creation of treatment and intervention strategies for those at risk for developing chronic pain after a TBI. In the longer term, the results could lead to new policies and procedures to help doctors and others identify and treat those dealing with chronic pain. It's always exciting to talk about this sort of research, knowing it can lead to improved health outcomes for our veterans and in turn for their families and communities. This important work is strongly aligned with the Legion's mission to enhance the lives of Canadian military personnel, veterans, and their families. We are grateful to the Canadian Institute for Military and Veteran Health Research for its collaboration. Since we established this annual scholarship in 2013, we have read submissions from incredible applicants and evaluated many groundbreaking research proposals. This year was no different. Through its innovative research, CIMVHR provides evidence-based knowledge that also helps the Legion pursue a range of advocacy work, and we thank them. Finally, I want to take a moment to congratulate all other award recipients. Bravo to you. On behalf of our 250,000 Legion members, we wish Meredith smooth sailing with her research. We're confident her work will play an important role in improving the lives of our veterans. Thank you. Merci.
Congratulations, Meredith, Sophia, and Sarah on your scholarships and awards. And of course, thanks to the Royal Canadian Legion, Wounded Warriors Canada, and Philip Edwards on behalf of Dr. Mark Zumarski for your generosity and for your commitment to supporting the next generation of researchers working to find the very best ways to support our military, veterans, and their families. Avant de laisser la parole à David pour clôturer l'événement de lancement, j'aimerais prendre un moment pour expliquer comment le forum est structuré. Virtual Forum is spread out over the month of October, focusing on a different population each week. The event includes expert presentations and discussion, as well as a virtual poster session. Events run Thursdays of each week from 10 a.m. to 1:30 p.m. Eastern. We hope that this format gives you the flexibility to attend all or some of the events without interfering too much with your regular schedule. Keep in mind that if you need to take a break, all presentations will be made available on the virtual platform after the date they've taken place. Following forum, they will be on the CIMVHR YouTube channel. Next week's event focuses on currently serving military personnel. The following weeks will feature presentations and discussion focused on veterans, families, and public safety personnel. Finally, forum was approved for continuing professional development credits. These credits can be earned from today until November 5th during the live or recorded sessions. Make sure you've identified in your online profile that you would like to receive these credits. That brings my MC duties to a wrap. Merci à tous pour votre écoute et j'ai hâte de vous voir en personne en 2022. David, over to you.
Thank you, Michael. We truly appreciate the role you've played in making our annual forum successful over the years. To all of today's speakers and presenters, thank you for taking the time to make our kickoff event a success. To our Platinum and Gold Forum sponsors, specifically Edgewood Health Network, True Patriot Love Foundation, and Sunshine Coast, thank you. We are grateful for your commitment to advancing health research. It will benefit our military personnel, veterans, public safety personnel, and their families. While we all miss camaraderie of joining together in person, this virtual space allows us for greater participation by all who are interested in the well-being of serving military, veterans, public safety personnel, and their families. People from across this vast country called Canada, but also our many colleagues overseas. People wishing to participate can register at any time to join every Thursday throughout October. So tell your colleagues and please encourage them to register. Thank you all for coming, and I look forward to learning and connecting with you over the coming weeks. Thank you again.